Welcome to the World Healthcare Congress Studio 2012. I'm here now with Brad Wilson of Blue Cross and Blue Shield of North Carolina, and I'm so glad to have you here today.
Well, thank you for the opportunity.
Well, Brad, how are you figuring out the role of insurance companies in the accountable care organizations? Is the way for you any more clear than it was in 2010, or?
Well, the way we look at it is this is a wonderful opportunity to transform the healthcare system in North Carolina or in the country. So we look at accountable care organizations and many of the other aspects of healthcare reform, both capital R and little r, as an opportunity to effectuate real change. So from an ACO standpoint, we embrace the concept. It's interesting to see when you talk with people, and you say, well, yeah, we're interested in ACO. What is that to you?
And what is the answer?
Well, the answer, they may describe something that looks like an innovation and collaboration that we have with UNC Healthcare, Carolina Advanced Health, where an insurer and a large academic healthcare system has come together to provide a new way to deliver care to patients. Other their definition may be more on the financing side, something far more narrow. Another person it may sound like that you have a healthcare organization wanting to get into the insurance business. But the point is, regardless of how you view an ACO, we need to look at it as an opportunity to increase quality and lower cost. And so we view ACOs as an opportunity for us to engage in those conversations, to think creatively from your vantage point and how we might together create a paradigm that will improve health.
Will your role, or has your role changed since these ACOs became really at the front of the conversation?
I would say that our role has changed, not necessarily just because of ACOs, but because of the revolution that the healthcare reform has triggered in our state and in our country. And one component of that is the ACO concept. And our role has changed in that what we are seeing and doing is that rather than waiting for the next contract negotiation with a provider partner to talk about how to improve quality, lower cost, and what we will pay for what it is that you do, is those things are happening along the way. And we're leveraging all of our intellectual capital to be more creative in care delivery and collaborative, absolutely. And so the role has changed from one of contract negotiator to one of collaborator, thinking creatively and innovatively, taking the best ideas that you have, combining them with ours, and the receptivity that we have seen in the provider community to ideas that we have. It's remarkable.
Have you found that this is making costs more containable? I mean, are you finding that things have gotten more efficient since you've been collaborating?
Things are becoming more efficient. You know, we're not there. This is going to be a long journey. It took us as a country and as a state in North Carolina a long time to get to where we are today. So one thing that we all need to remind ourselves is that there's not going to be any magic sauce here that in 2 or 3 years is going to completely solve all of our challenges. So let's look at it as a journey. Let's react to that opportunity to take this journey together with a sense of urgency that will then bring the kind of cost efficiencies and quality increases in care that we will want to see. But the record so far, and I've only been in my CEO role now for a little over 2 years. The record so far is we are making progress.
Any data you can point to that shows a percentage in terms of things becoming cheaper by this amount or anything like that?
Well,
hard evidence?
Yes, not as much as, ask me this question 2 years from now, we'll have a lot more. But for example, one thing I would point to in North Carolina, we have a bundled payment paradigm with one of our hospital systems there that didn't exist 2 years ago. And we have a number of others of those approaches just ready to go. And that is a new way of paying for higher quality care. So that would be one tangible example. Our collaboration that I alluded to earlier with UNC Healthcare System, Carolina Advanced Health, where together we will share in joint savings over time. Has it yielded anything yet? No, because we just cut the ribbon December the 7th.
Okay.
But we believe that by year 2 or 3, it will be yielding hard evidence that these new relationships, they're moving the needle.
All right. Great, Brad. We look forward to getting an update from you
Well,
in a
thank you.
couple
I
of
do
years.
appreciate the opportunity.
Thank you.
Sure.
I'm Mabel Jong. Thanks for watching.